I'm audible? I am audible. Can you?
Yeah.
Yes, you are
Yeah.
audible.
Thank you so much. So, welcome to today's session from Alert to Recovery, Communication and Disaster Management. In this session, focuses on the importance for the communication and disaster management, covering its role in preparedness, response, and recovery. Its highlight tools like early warning and digital platform. In then in this uh, like session, the session aim is together stakeholder enhance communication framework, empower affected community, and improve access to timely and accurate information. And communication is an important part of the humanitarian aid, helping people to get their right information at the right time during crisis. It guides them to make safe decision and access help. Good communication build trust, engage communities, and support recovery. It also allow to people to share their concern and be part of the solution. And now I would like to invite moderator of the day, Ms. Atisha Sood ma'am. Uh, uh, Atisha Sood is a consultant in public health, Center of Disaster and Health at the National Institute of Disaster Management, Ministry of Home Affairs, Government of India. Welcome, ma'am. Over to you. Ma'am, you are on mute. Just give me a second.
Hi, so good afternoon. Thank you, Gursimran. Welcome all of you to the webinar on From Alerts to Recovery. We are going to be talking about the communication as a key catalyst in disaster management today. The session is going to be an hour and a half long from 2:30 p.m. till 4 p.m. We have a line of very learned speakers, and they're going to be talking to us about the various different components of communication and how it can act as a key catalyst in disaster management. First up, we have Mr. Anil Gulati, sir. He's a communication specialist from UNICEF Bhopal. He's going to be talking on the communication in disaster risk reduction. Uh, Anil Gulati, sir, is a seasoned a professional with over 20 years of experience in advocacy, communication, media, and corporate engagement. He holds a master's in mass communication and journalism degree. He's a postgraduate diploma holder in international trade and has a bachelor's in pharmacy, providing him a strong foundation for addressing issues related to children and women. For over 11 years now, Anil sir has been associated with UNICEF, leading impactful communication campaigns, high level advocacy efforts, corporate engagements, and strategic representations. He has successfully driven change for children by utilizing media, civil society networks, and collaborations with decision makers, including political leaders and various corporate stakeholders. His career spans work with international organizations like Rotary International and national NGOs in India. He has designed and implemented diverse communication strategies that have brought meaningful results for children and communities. His professional journey across India and overseas has strengthened his ability to manage diversity and enhanced his understanding of political media, government, civil society, and corporate environments. Known for his strategic thinking and dedication, he continues to champion the rights for children and women through innovative communication and advocacy initiatives. So, welcome, Anil sir, and I would like to hand over the stage to you now to talk about communication and disaster risk reduction. I would also like to inform our participants that they can write their question and answers in the chat box while our sessions are going on, or they can hold on to their questions, and we have a dedicated question and answer session at the end of the webinar, so we can maybe take up the questions then. Over to you, sir.
Thank you, Atisha. आपका बहुत बहुत धन्यवाद. Thank you for my kind introduction words, and thank you, Spear India, for organizing this very important meeting on communication. What I'll do is I'll just open the slides. I'll share my slides so that let me just put it on a slideshow. Hello, ma'am. आपका बहुत बहुत धन्यवाद for introduction. Can you see my slides, ma'am?
Yes,
Hello.
yes, sir.
Okay, thank you. Thank you, Spear India. Thank you, Atisha, ma'am, for a kind introductory words. It delights me that Spear India has done a work on communication, because that is an area of work which actually needs lot of more work to be happening in disaster. Disaster and communication. For an effective disaster risk communication is actually a heart of any DRR work we do. It's like an oil which helps to flow the information and knowledge flow among decision makers chain. And in fact, consistent efforts are needed to make sure that we get right knowledge when disaster impacts to both decision makers and people at risk. In fact, risk communication remains frequently, what happens is it remains at end of a planning process rather than being threaded all over the times when we are doing it. And the pictures which I'm using are pictures taken by me. It was from Ayla cyclone, for information, and from Madhya Pradesh. Okay, when we talk of disaster risk communication, there are three words which I really wanted to focus on. And COVID actually told us, pandemic became infodemic. Infodemic was kind of too much of information, including false and misleading information. Miscommunication, by contrast, the speed of disinformation was very high, and which was a very barrier for a usable information or used information which can be given to people who get affected. And more important is, whenever we design any communication work or any communication effort, we need to reach vulnerable population. So we need to be very sure whether our information reaches the most vulnerable. Do they access that information? And if they access it, can they understand it and use it? क्या वो समझ पा रहे हैं इस चीज को और इस्तेमाल कर पा रहे हैं? If you look at communication in emergencies, these are 4 phases, and I've divided what can each phase need to be done. In terms of preparedness phase, basically it communicates. We need to, as communication professionals and the DRR professionals, we need to make sure we communicate messages that encourage and educate the public in anticipation of disaster event. Same is during response phase. Are we able to give public with a notification, warning, situation reports, evacuation? How do they do? What should they do? In terms of recovery phase, whether individuals and communities affected by disaster get the information on how to register, get relief from the state government or the government at the district level, how to prevent diseases, epidemics, and other problems which we face in disaster. In terms of mitigation phase, again, the communication promotes those actions which will reduce lives and property disasters in future, any future happenings. Now, since I work in Madhya Pradesh, and I'm a kind of a field level person who has been working in field for quite some time. I just try to identify very practical barriers. I'm not going to too much into theory of what it is. The one of the barriers which we see is that all the guidelines, advisories, or national announcement reach only at a senior level at district level, while the need is at block level, at village level, at panchayat level. Many of these are very text-heavy guidelines, not so friendly. The communities which get affected during disaster have a limited access to media sometimes. Even mobile, suppose like example I know is when Shiopur had floods, when people were evacuated, they couldn't even charge their mobile phones back, which means the information, flow was kind of hampered in the whole process. Information on where is a space, what is a facility, where to go for incident. For example, is our state has seen some major fire incidents, and there was a challenge or to see where do I rush. Interagency groups, what is the capacity of interagency groups in terms of communication and what is their reach? They do a very good work on terms of DRR, but in terms of communicating rightly with messages to communities is a challenge. Way messages are prevented has an influence of people's reaction to it. For example, if I get to know the reason I'm saying is, if one knows that there is a flood, you don't know when it is happening, where it is happening. But if information is given where exact time and place of event is given, the communities act much faster and they understand where to go, what to do. Then is a whole issue of trust from the people you are getting this message and how do you react on that message. There are 9 principles as per UNDRR, which has been given in terms of risk communication. For any communication which you design, it has to be interactive. Interactive means which is interactive with communities. It has to be a multi-channel communication. Personalized, because if you don't have a personalized message, we believe it doesn't work so accurately. It should be very accurate, because COVID and all these floods, fire incidents, has taught us that we need to give right and accurate information to people who get affected. It should be clear, concise, and there's a one word known as consistent. That is extremely important because when they get different messages from different people, it has a different impact. So it has to be consistent. What various NGOs are giving, UN agencies, government, there should be a consistent messaging. It needs to be timely. Timely means when it is needed, it is available. It should be some kind of a, it engages a people. It should be not like a very, very typical text heavy, which people can't understand. It should be useful and leaves no one out, at least especially the vulnerable population. Okay, when we talk of emergency communication, our major focus is to make sure that we are able to get message to audience. Who is the audience here whom we are trying to reach? Affected population. Urgency of the message is quite key to the whole process. I have said this earlier also. And how reliable are the available media? Appropriateness of the media, which media is best communication for this particular circumstances. If there is, whether you're using which channel is important, and what are the resources which are available to organizations which work in this area of work. Okay, but what is a right communication tool? A right tool for us is basically, sorry, is a matter of getting right information to right people at right time and make right decision. Any tool which reaches target audience, which is a affected population, or when you're doing a preparedness which needs to be done, or if you're doing a recovery phase, what information to be needed to make sure to reaches a target audience. Get information to the audience when they need it and for as long as they need it. It is not that you just give it once and then you finish it off. You can be expected to deliver the message reliably, comprehend the message, and can be accessed within the resource limitation we have. Okay, what has happened is if you look at the Indonesian earthquake, if you look at COVID, if you look at all the recent disasters which have happened, and even their recovery phase, if you want to move into recovery phase, the major dynamics is use of social media. People are using new data source, they're getting real-time information. State government, in fact, nowadays what happens is there's an emergency, even state government gets information first from social media rather than then trying to get access to what is happening at the ground. And we have seen it in all our recent emergencies. This has happened. Twitter, Facebook, WhatsApp, Instagram, YouTube are basically new source of information and dissemination. You know, we say tracking hashtag and keyword is now crucial, but I can also add to it, hashtag is also losing its relevance. Now, keywords matter more than anything else. The speed is of social media is very fast. You know, like I know for Harda fire incident, if somebody knows in Madhya Pradesh it happened, the speed of information came first from social media, then from other channels starting coming in. Local incident gets reported first on WhatsApp, Facebook, Twitter, and then actually media picks it up. So social media dynamics has become more and more important than what it was today. And the consumption of social media has increased tremendously. Okay. You know, what I had said to Gurman was that I'll try and say some examples which we saw worked on the field. One is the information sharing by the state. You know, what happens is any emergency, we need data. All agencies need data. We want to understand what is happening. And the best source of information is state government. One needs to work with state government to empower them to release data. Thanks to the work by NDMA, NIDM, state disaster management authorities, the data is now available faster. It's available. It's a relevant information which is available. Same is human interest stories. We saw that during COVID, fact checking was extremely important. You know, and we at UNICEF Madhya Pradesh worked with Data Leads, which is a Google-based company, which help us to train a lot of people on fact checking. And this is so important because any information, and as I was saying earlier, the social media has become a crux in today's world, and fact checking becomes more and more important in these cases using the various fact check tools which are available. We have fact checks by Data Leads, by Google, by Reuters, everybody of them. But good part is Government of India and state governments have their own fact check tools. Press Information Bureau is one. State government does its own fact checking. One can refer to handles of WHO and UNICEF before kind of believing on information or any messages which is coming to you from the WhatsApp. COVID told us power of audio tools like radio. You know, we worked in Madhya Pradesh, we worked with Radio Mirchi, private radio station, and All India Radio to make sure that authentic information reaches to people who matter. I still say with a lot of proud and a lot of support from All India Radio, still AI in Madhya Pradesh has a much, much higher read, and especially at block level. I mean, you know, private radio stations are taking it over, but it is only in the city. If you can look at reach at block, district level, that is an All India Radio, and it conveys the right information. Our work with government media channels, I encourage everybody to see that we work more and more with these channels like All India Radio, Doordarshan, and Press Information Bureau. Example was, you know, lightning kills a lot of people in Madhya Pradesh still, but we use their channels and sought their support to make sure to disseminate information which is available in public domain. SMS now, thank you. Thanks to the Indian Meteorological Department, now we get very fast SMS on lightning and rains. So which is quite empowering for communities to make sure they can get safe. WhatsApp, you know, UNICEF during COVID had worked with WhatsApp administrators and group admin to make sure that we spread right information. We don't just pass on any information which is coming through. There is a kind of a sieve net which actually sieves the right information and takes it forward. So these are some examples we tried and it works. If somebody would like to replicate, more than happy to support. Other examples is UNICEF in Madhya Pradesh and India works with a lot of social media influencers. We do a lot of meetings. The idea is to make sure that we are engaging with them in preparedness phase, mitigation phase, and talking to them for a right stories. We trying to see, you know, we do a lot of walks also for stories, majorly on health and child health and nutrition, make them visit the field. We do a lot of media information packs, which are basically easy to use media packs like for lightning, heat waves, breastfeeding, to help them give the right information in terms which can be used in all communication which they do. We have dedicated group of journalists who report on disaster, health, and other information. Visuals like this is a story of a A&M which was doing a phenomenal good work on measles in Jabalpur. So visuals matter more in disaster and even recovery phase. Use of social media handles of state government is quite important. You know, I really encourage whatever, if you want to seek information, you seek the right information from the handles which are which are a government of Madhya Pradesh, India, or whatever NIDM or NDMA handles. I just wanted to take few slides from my colleague Alka, who just shared it with me in from Delhi office on media preparedness. For any work we do, we need to have media preparedness done. For that, we really need a media database which is ready. We made to sure in any organization which is SDMA, NDMA, or even for a private civil society organization, we have a spokesperson who speaks, who understands the issue from the field and speaks the right information. We train spokesperson, do refreshes and crisis simulations, if any, and have their biodatas ready. What to do in first 24 hours of emergency? Flag emergency internally in any organization you work in. Try to see if you can support government to issue statements. Like we work with here with Madhya Pradesh government to get the statements out in terms of people affected, place affected, or what is being done by the state government. Reach out to journalists quickly in the golden hour, develop quick lines. We work with videographers and photographers, offer the right B-rolls to journalists. Even today we see any big event which is happening, a lot of other B-rolls start playing in any environment. So offer them a B-rolls. Try see if you can visit them to field. Let them meet the families and frontline responders. There are very limited stories which come on frontline responders. If you can encourage that more, it will be good. And provide the right information on the social media handles which is available. What to do throughout the response and early recovery? For media communication, develop media Q&As and key messages. Provide data and information to journalists from SITRAPs. Do media briefings after the visit to the emergency areas. State government does it. Be a part to it if you want to be part of it. What to do post-crisis is keep engaging with journalists. Monitor media and share of voice analysis, what is happening. Also monitor if something negative news is coming and how do we kind of tone it down and bring it to a angle which is positive for people rather than spreading rumor. Lessons learned, what can you do better, and review the spokesman's list. That's it from my side. I've given whatever I thought, which is an experience from the field perspective. So over back to you, Gurman, and I'll be happy to take questions and any responses or any questions which come up.
Thank you, Anil sir. I think the experiences and knowledge that you've brought from field are for sure very informational for our participants. The 9 principles of risk communication that you shared with us, and the importance of social media that it plays, and along with that, the information overload that exists, and the need for filtering out the right information and information that is authentic and useful for our participants. I think that's most important in times of any sort of disasters. So thank you, sir. Question and answers, we have a few questions in the chat, but if you permit, we can probably take the questions at the end of the session after all the speakers are done.
Sure, ma'am. Thank you. Thank you very much.
Okay. Okay, thank you, sir. Next up, we have Miss Divya Gupta, who's the Associate Director of Advocacy and Partnerships from Seeds India. She would be talking to us about strengthening trust and inclusion in disaster communication. Ms. Divya Gupta is a seasoned humanitarian professional and climate advocate with over 20 years of experience managing emergency operations and driving resilience building initiatives. Since 2004, she has led response to 10 major crises, including the Assam floods, tsunamis, Gujarat flood, the Kashmir earthquake, and Nepal earthquake. Her expertise encompasses immediate relief, transition responses, and long term rehabilitation with a focus on water, sanitation, environmental sanitation, and hygiene promotion. As a co founder of the Climate Action Resource Network Asia Pacific, CARNAP, and the WICCI Gujarat CSR Council, Ms. Gupta has showcased her commitment to addressing pressing social and environmental issues. She has also played a pivotal role in national emergency coordination during the COVID-19 pandemic, providing strategic support to the state, interagency groups, and different networks. Recognized with accolades like the ninth Udgam Women Achievers of Gujarat Award of 2018. She has trained over 12,000 individuals, including communities, government officials, and NGO staffs in capacity building and advocacy. At Seeds India, Ms. Gupta oversees advocacy, partnerships, and localizing efforts, ensuring disaster responses are tailored to the community needs. Her work is dedicated to fostering resilience, equity, and sustainability, creating meaningful impacts for the vulnerable communities. So, welcome, Dr. Gupta. Thank you for sparing your time and thank you for taking out time for this webinar and interacting with our participants. So, over to you to take us through the
Thank you,
presentation.
Atisha. Actually, you introduced me very in detail, but surprisingly, all colleagues present here, they all know me. They all know me for last 20 years. Our sector is very small sector. So before going to the main discussion, I would like to share few case studies from seeds and different organizations and government. I mean, these case studies will help you to understand and relate your work, how you are trying for the inclusion in disaster communication. Like if you guys remember during the COVID-19 time, Pratham, the organization, they have gone for a misinformation combat workshops. They gathered so many volunteers, community volunteers, and trained them how they can identify the wrong information if any kind of rumor is spreading. Sorry, sorry. So any kind of rumor is, I mean, spreading in the area related to COVID-19 or whatever. These volunteers, these trained volunteers, they were going back to the community and they were, I mean, providing the right information to the community members. So, and also, I mean, Seeds, I mean, we worked for the last 2.5 years making a new kind of effort under the guidance of NDMA and other STMS also supporting us. We established a platform called Akshvi, Aapda Chhati Vibran, where each and every family which is affected by any kind of disaster, they are getting opportunity to register their own losses and their own urgent needs. So initially in 5 disaster, we were like in a pilot basis, but recently in West Bengal after this cyclone Dana effect, we could collect, we could engage these community members. They have reported their whole loss and damage, their family detail, like their family profile, and the urgent needs, whatever support they immediately require. And within few hours, that information came out, and we engaged local volunteers and local community leaders as a verification agents. They have visited these families and identified whether that information filled by family is right or wrong. And immediately they verified the information, and within few hours, that information by default over this platform analyzed, calculated, and divided into the customized kind of relief. Which particular families require the hygiene items, which particular families require the food item, or who is required the cash, unconditional cash support. So within few hours, the normally GRNA and the other activities we were doing for last 20 years. Initially, when I started my journey in 2004, it used to take around 7 days to 10 days. In last few years, we could reach to the 3 or 4 days time. But within the Akshvi, this whole exercise can be done within few hours. And there will be a pop-up SMSs among the community, and they will be getting opportunity to register their loss and damages. They can utilize any kind of channel. If they are having smartphone, they can do that through the chatbot or putting on a link, Kobo link, and they can fill the form. And if in case they are not having phone or they are having the keypad phone, they can call to our call center. IVRS system is there, and they can just put the entire information there via phone call. And in case that phone call cut, they again get the on the same number, our people will be calling back until they will not complete their form. So in West Bengal, last the real time pilot we could do in our West Bengal, there we could find around 100% families, targeted families, could complete the entire form within the time. And when this verification agent gone, they could find the 97.8% families could put the information on a right. Those information was the right informations. Normally, what we feel, we will be giving them chance to give their own information. They will be overestimate that information. They will try to over-report their information. But we should trust on community. And we could find that now, I mean, their wallets are preparing, and these communities are connected with the right kind of recovery actions. And in a future, because this area is a multiple disasters are happening all the time, cyclones are coming, so these families can again and again support, and this information will always be there in their wallets, and they will be updating this information, their family profile and each and every information, and whatever development support and recovery support they are receiving, that will be added in their information. So in case any other disaster happen in future, we will not require to go back to them and collect the data, because we are already having 90% data of those families. So this is how communication is taking the place, and we should utilize the opportunity of AI and the other tools and other technical things. And if you remember, during Cyclone Fani time, these community volunteers, the local radio group, they spread the information and they help government in a evacuation of the community. So within 12 hours time, government could evacuate more than 8 lakhs people. So it is only possible when local level communication is there, like local radios, local volunteers. So rather to bring the outside support, we need to build the capacity of local system, those who are already available there in the community. And if you remember one important example I would like to make here from the Aid India, like they establish a system where families will be receiving SMS in a very simplified language, in a local language, related to any kind of disaster. Maybe it's a lightning or flood or high rain, whatever is going to happen, these family will be receiving the SMS in a simplified language and a local language. So SMS based this early warning system help this community to protect themselves very much on time. If all of, we all are, utilizing those IC material developed by Save the Children and UNICEF and other partners, like the material which is developed for the children, they are trying to build the material in a very, very child-friendly way, where children are liking this IC material and trying to read those materials, utilizing those materials, those learning materials, IC material. So it should be very, very inclusive. So these 3-4 case studies I wanted to share before to going for my main presentation. So thank you. You already put it here. So, Anilji has already covered few points here, like how we can combat the misinformation which is spreading in the community. We remember just 2-3 days back, there was a small fire in a train. It was not even fire. It was just a short circuit. And just for a few people just try to go out from the train, and another train, due to another train, 13 life loss has happened. So misinformation is already there. How we can try to bring the right information on time, so people can protect themselves, like understanding the challenges, the local level challenges. Who are those people, those who are spreading the fake information, maybe through the WhatsApp channel, maybe through the local systems? Who are those people, those who are bringing the wrong knowledge, wrong information, fake news? And how we can and role of trusted sources. So during the peacetime, we need to educate our community which sources are the trusted sources, like the media, newspaper, radios, which are the sources, are trusted sources where community can rely during the disaster time, and they can get the right information on the right time. And fact checking mechanism should be there, and those who are spreading the wrong news or wrong information, they should be punished. Then only we can overcome this kind of scenario. So Anilji has already covered, so I will not go in a detailed way. Next. And promoting media literacy, like we should not rely just on the outside media. There is need to bring the local people to play the role of media, like radio volunteers are there, community volunteers are there. So video volunteers, if you remember the video volunteers concept, they just train the local youth, and these local youth play the role of active media in these among the community. And now social media influencers are also there, and surprisingly from the many remote areas, there are media influencers. So these media influencers can be engaged to spread the right knowledge and right information pre and post disasters, and ensuring the equitable access, where those who are the last mile people can also get the information. Those who are not having phone or maybe they are just, dependent on the PRI and other system. So miking system and other system can be placed for them. Next. And creating inclusive content strategy, the local language, those who cannot read or write, those maybe some community member require the braille IEC material in a braille, and there are elders people, there are small children. So what kind of content they can read, what kind of pictures they can understand. So based on the local culture, local language, local understanding, the literacy rate, based on that we need to develop such material and spread those material, like identifying marginalized group, those who are always left out, those who are always behind. So how we can bring them and develop such communication material which they can get access also, and they can, it would be, help make them understandable also. And content personalization, if you are talking about the Bihar and you are utilizing the pictures from the Kerala, may not help. So how you can personalize that information based on their local issues, their environment, their culture, their clothes, their dressing, everything we need to utilize based on the local thing. And inclusion language and formats. If someone is required assistance in reading, how he or she can access this information. And community participation should be there. They know their things better than us. So they should be participate in the designing of such IEC material. I remember in a WASH, Bihar's IEC material was very, it's a very long time, 15, 20 years back, they were having this WASH material, how to wash the hand, how to make the ORS, how, no, there are, these all material was available in Hindi. So which other Hindi states could also use that time. I remember it was around 15 years back. So how the local perspective, the local language and local understanding and local things can help them to utilize in our communication materials. Leveraging technologies. Now there is a huge technology. If people can use the technology for the entertainment and other things, why don't we use this technology for protecting the people from disasters, and how they can continue their right time relief support and right time recovery support and their entitlements. So technology is available. It is up to us how we can utilize it. So we need to build the capacity of our local NGO partners, because they are always there, whether emergency is not there, but they are always there working with the community. All the time they are sitting with the community. So if we will be building their capacity, providing such communication material to them and helping them to build their own communication materials and bringing those material on a social media platforms where it can be scaled for the other community members also, it will be helping them. Next. So mobilizing support is also required. So our right communication will help us. So in mobilizing this fund, how we can write our appeals, what kind of pictures we use, how right time in we can receive the photographs from the community, and what are the what kind of picture should not be used and what kind of picture should be used, and collaboration with the local media. Collaboration. I just need 1 minute. Sorry. So collaboration with the local media, collaboration with the national media will help us to bring that knowledge from top to bottom and bottom to top. And transparency and accountability. Those who are spreading the information, providing IEC material, they are equally accountable. They have no right to spread any kind of wrong information, any kind of indignified way of communication, any kind of wrong information. And campaigns for public support, no, not only the disaster time, but the peace time. During the normal time, they should get all the information and knowledge. So during the disaster, such IEC material can be utilized in a right way. And influence through the partnerships. There are stakeholders, those who have voice, like local community leaders. People listen them. Faith-based leaders are there. Social media influencers are there, to whom normally youth follow a lot. there are celebrities who, whatever they say, people used to follow. So there is a partnership requirement with the people whose voices are really people hear and they follow them. So this kind of arrangement can help us to reach to the people on a time with the right information, with a better way of information. Next. Yeah, it is done. If there is any question or anything, I'm available.
Thank you, ma'am. Thank you for your insightful presentation and the case studies that you shared with us. I think they're of great importance and will obviously and for sure help our participants better understand the need for inclusivity in the time of communication while we talk of disaster risk resilience. So, thank you, ma'am. We'll take the questions at the end. And now we have Mr. Anthony Chetri. He's the lead organizational and program sustainability expert from IGSSS. He's going to be talking to us about strengthening stakeholder collaboration in times of disaster communication. Do we have Mr. Anthony with us? I can't see him. Okay, yes, sir. So, Miss, while you unmute yourself, I would like to give a brief introduction for Mr. Anthony.
Yes.
Anthony Chetri, sir, is a seasoned development professional with over 17 years of expertise and extensive experience in strategic planning, project management, and social inclusion. Throughout his career, sir has successfully improved the livelihoods of marginalized communities across India, leveraging his expertise to drive meaningful and sustainable impact. Currently leading capacity building and partnership efforts at IGSSS, he is known for his ability to mobilize communities, integrate gender perspectives into development initiatives, and navigate complex challenges with innovation solutions. Anthony's career spans diverse roles from academic lecturing to spearheading strategic development for renowned NGOs, showcasing his versatility and commitment to social change. As a PhD scholar in social work, he has a deep passion about fostering inclusion and empowerment. His leadership, coupled with a strong academic foundation, has established him as a trusted expert in the field of development. You can also connect with Anthony Sir on LinkedIn to learn more about his inspiring journey and explore opportunities to collaborate for further impactful change. Over to you, sir. Please take us through strategies for strengthening stakeholder collaboration and the role of government, NGOs, and different communities in inclusive communication strategies. Over to you, sir.
Yeah. Thank you. I would love if my presentation is put there on the. Yeah. So thank you so much for the introduction. And I would like to talk about strengthening stakeholder collaboration. I hope I'm audible. Yeah. Hello.
Yes, sir.
Am I audible? Okay.
Yes.
Okay. So basically, if I start and if I club the different, there are so many stakeholders with whom we all work during disaster or disaster preparedness, even after disaster for relief or rehabilitation and developmental work. So we have tried to club these stakeholders into three major categories, which are very important stakeholders: the government, the NGOs, and the communities. These are the three pillars stakeholders. Whenever we work in disaster, we work with three of them. So based on them, now I would like to, if you put the next slide, introduction. Yeah. So my presentation will be talking about the role of the government, the NGOs, and the communities, because the communities, the NGOs, and the government, three of them have their different roles. So if you go to the next slide, the key phases of disaster management and role of communication is preparedness. I have touched early warning and alert. I have touched response, and I will also talk about recovery and rehabilitation. In these four key phases of disaster, how government, NGOs, and communities should work. Next slide, please. So the first part is the preparedness, and preparedness talks about when the major objective of preparedness is enhance readiness through collaboration, planning, and information sharing. So, in this process, the role of the government or the strategy of the government should be, and generally is always, we have seen in many parts of the countries, to develop and disseminate the disaster preparedness plans and policies across all level of governance. That should be the major role. One of the we have seen in West Bengal, we have seen also in many states, the different level of governance in the government structure to work together, to collaborate and convert is a big challenge. So that should be the role to come out of this challenge is one of the things that the government should take care of. People's technical training, establish disaster response teams in vulnerable areas, to sensitizing different level of governance. And it's very important what I'm trying to say on how to ensure that no caste-based discrimination and gender blindness are there in the governance. Gender blindness, I'll talk about that. And also there is no caste-based discrimination. For that, the different officials and different level of governance need to be sensitized if we are talking from the angle of communication. NGOs should engage at the community-based training programs and stimulate them, sensitize them, focusing on vulnerable populations such as women, children, person with disabilities, trans people, and everything. So in preparedness, this is the major role, engaging at community-based training. But the community also have a very important role in the communication. They should actively participate to help the government and the NGOs to have a proper risk mapping, disaster planning sessions. They should prepare, they should share the indigenous knowledge, indigenous practices to strengthen their resilience or preparedness, that they should communicate properly. These are the three things, three people, the government, NGOs, and the communities need to take care of while communicating during preparedness time. Next slide, if you get into that, is early warning and alert. So the major objective during this phase of disaster preparedness is disseminate timely and accessible information to minimize risk and enable actions. So for that, government deploy multi-channel warning systems, SMS we have seen, radio, siren, all these, and ensure inter preparability between agencies, partnered with meteorological departments for real-time updates. So this communication between all these departments, different, be it meteorological department or with the department which carries on the SMS or the communication, radio, television, how government communicate with their own system, that is very important. Facilitate, the NGOs should facilitate this translation of warnings which is coming from the government into local languages, culturally appropriate formats, collaborate with community leaders to ensure that this last mile or the last person in the community gets this communication, or the last mile of communication is reached. And the communities also should identify, train their local volunteers as first responders who can communicate warning effectively within the community. So this is when the early warning and alert. Can we come to response? Next slide. So in response, basically coordinate rapid inclusive actions. So during response, the government should establish a centralized communication hub. Like there are a lot of states which have the interagency group, IAG platforms and everything. So government should ensure that there is a platform, there's a communication hub, a real-time updates are happening, that the government should facilitate, because this is a very important time, and here the communication need to be there very accurate, so that whatever my earlier speaker have said, miscommunication, everything can be stopped here. NGO should act as an intermediate between government and community. So that time the communication of the NGOs should be such that they should not blame each other, the government and all, but bring back what is the need of the community to the government, and also communicate to the community what government want to do or what is the government perspective, and help to resolve the problems. Help the government to reach the most marginalized group. So how the communication at that time the NGO should take to do. Communities should mobilize grassroots networks, report on-ground needs and challenges, because if they don't communicate, then again NGOs will not able to do anything, or the government. So that communication also, the upward communication community also should help. The next slide, recovery and rehabilitation, the last phase. The basically is the objective is a long-term rebuilding or restoration of livelihood. That is the major objective during this time. So from that angle, the communication strategy for the government to ensure a transparency by sharing regular updates on recovery progress. How is the fund utilized? How much fund has been given? That information, that communication should be there, which should ensure transparency. NGOs, their role on communication strategies, advocate for participatory planning. Continuously, the NGOs should tell the government that everything that we do for recovery and rehabilitation should be a participatory planning. Development of IC materials to support recovery programs. That is the role of NGO. And community should collaborate with stakeholders, co-design the recovery plan, help the government to recover the plan, use storytelling and case studies to share their experiences and lesson learned. So these are the 3-4 phases for which I have tried to put in very short what will be the collaborative strategy of communication among the different stakeholders. If now we come into the next slide, that is strengthening stakeholder collaboration through inclusive communication. If we go to next slide, I want to focus or I want to stress on multi-stakeholder platform. So this collaboration, the communication strategies we heard, but how do we collaborate? So collaboration for that, the first thing that should be there should be a multi-stakeholder platform. Government should create a platform for dialogue between different agencies. NGOs should leverage digital tools for joint planning, monitoring, and also bridge gaps between government and communities. Committee should participate actively, so there should be a multi-stakeholder platforms which can build the collaboration. Next slide. This stakeholder collaboration can also be developed only when there is a trust and there's a transparency. So the government, the NGOs and community should communicate in such a way that there is a trust between 3 of these pillars or the stakeholders, government, NGOs, and there should be transparency in all these. Among the government, there should be transparency. NGOs, communities, there should be transparency. Next slide, if we get into localized communication efforts, that is a very important thing that can help for more strong collaboration. That is localizing or developing region-specific communication protocols by government, considering cultural and linguistic diversity. NGO should work with local leaders to develop inclusive communication materials, that how a trans person will understand, how a woman will understand, how will men will understand, how youth will understand. So that all communication efforts should be taken by the NGOs. Communities should share their traditional communication methods. I know in many parts of countries where we did, IGSS did, we used many times a traditional communication like song, like drama, jatra, basically in West Bengal and Orissa, or maybe you can use many of such local song, poem, or platforms to communicate and localize the communication efforts. Next slide, if we take, is one of the things that can collaborate very strongly is the feedback mechanism. So institutionalizing two-way communication. Not only the government will say, but the government should also see that the public feedback grievances coming, NGOs helping to get that community feedback, making community aware that go and give feedback or take the community feedback to the government. And communities should not keep quiet. They should share concern. They should share the challenges. Many a time we have seen the communities are kept quiet, maybe for various reasons, but they should not. So there should be a strong feedback mechanism, and the feedback mechanism should be such that if I give any feedback, then there should be an action. Otherwise, there will be disillusionment among the communities. In my last few slides, 1 or 2 slides, next slide, the challenges and recommendation that I want to say, next slide. The challenges is misinformation leading to panic and chaos. That is something that the communication everywhere, if there's no proper communication, the stakeholders don't collaborate together, then this is the limited accessibility of communication channels in remote areas. That is a very huge problem. I mean, last part of a village, which is like underwater or being heated by cyclone, the accessibility of communication channel, language and cultural barriers is also. And one of the challenge that I've seen, blind spot. Many times we do preparedness, we do relief, we do recovery from a very generalistic perspective. Nowadays people are talking about inclusive. I think I know that things have changed, but still, is the last is the person, the Dalit man or a Dalit woman or a scheduled caste or a scheduled tribe families really getting every support that they require? Do we think about, when we distribute relief, only men and women, or do we also think for men, women, trans women, that kind of desegregation, that type of inclusive perspective do we have, or we have a blind spot? We think that okay, relief दे रहे हैं तो ये लड़का आदमी और औरत ही होगा, and that we generally take it. So from that blind spot we need to move. That are the challenges. The next slide I want to say is that recommendation with which I want to end also, that is invest in capacity building for stakeholders and inclusive communication technologies. Design communication materials in local languages and accessible formats. Strengthen partnership between government, NGOs and communities. The era now where we are living is there's a lot of mistrust between all these three people. Government don't trust NGOs, NGOs don't trust government, communities don't trust NGOs, NGOs don't trust communities or government. So there is this whole area now. The time is such, so it's very important that we strengthen the partnership by shared ownership of communication systems and sensitize people. It's very important. Sensitize basically the government people, the NGOs, the communities to involve in different steps of disaster management, the caste which are marginalized caste, and gender who are marginalized genders, trans men, trans women, women definitely, but also from men and women, most marginalized are trans men and trans women. They should also be thought of, and people should be sensitized to find them and talk to them. We don't take an extra effort to find, इस गांव में trans men नहीं है, पर सचमुच अगर आप जाओगे तो जरूर मिलेगा. And we have seen it in Kerala flood. IGSS have like made it a thing. We will look for a trans man and trans. And we found around maybe in 100, we found 5 trans men and trans women. So that is one of the things. And I end with the next slide conclusion, where I would like to say that inclusive communication strategy is very important to strengthen stakeholder collaboration across all phases of disaster management. And hence we need to see that from alert to recovery, inclusive communication, which should ensure no voice is left unheard and no action delayed, leading to safer and more prepared communities. Thank you. This is what, in short, I tried to say. If there are any question, I'll definitely take it. I am basically now in Sambalpur and in Odisha, which is a state which is like hit by disaster, cyclone, flood. I'm speaking from that land, and I feel very honored to be given this time to share my views. Thank you.
Thank you, sir. Thank you for sharing your insights with us and giving us different strategies how we can strengthen stakeholder collaboration in type of disasters. It's funny that you mentioned you are in Bhubaneswar. We just conduct in Odisha. We conducted a training for inclusion of DRR in various CSR initiatives of Tata Group that could be taken up by them. We were there the last week and we discussed on different projects that can be maybe taken up, and we talked about different vulnerable groups, marginalized communities that could be considered while we talk of CSR initiatives or various, big companies. So thank you, sir. Thank you for sharing your presentation with us. And now we have Ms. Shampa Sen Gupta. She's the director of Shruti Disability Rights Center. Uh, Ms. Sen Gupta is a Kolkata-based activist working on the issues of disability and gender rights for the last 4 decades. A special educator by training, she is the founder director of Shruti Disability Rights Center, and her focus of work currently is to bring in changes in laws and policies intersecting disability and gender. She is going to be talking to us about enhancing early warning systems for individuals with disabilities and the use and various strategies that maybe we can take from that for having communication as a catalyst for disaster management. Miss Sen Gupta, are you here?
Yes.
Yes. Over to you, ma'am.
Thank you so much for giving me this opportunity or rather, I would say giving a disability group to speak in a mainstream webinar, because that is something we keep on saying, that as one of the marginalized groups, we just feel lot of time we are not included in the dialogues. So thank you, Sphere India. And after hearing such, it was really very well expressed, the three presentations. I just want to talk a little bit about what exactly it means when we want to include people with disability in our disaster management communication. I just talk a little bit about the current laws. UNCRPD, we have India ratified United Nations Convention on Rights of Persons with Disabilities, which in the Article 11, the CRPD says that persons with disabilities should have access to emergency services during natural disasters and armed conflict. In the same convention, CRPD Article 9 says people with disabilities should have equal access to physical environment, information, and communications. So when we are talking about communications, what kind of communications we need? We, of course, when when India ratified even CRPD, it became imperative to change our law. So our disabilities law had been amended, and the new law came. It was not amended. We got a totally new law in 2016. The Rights of Persons with Disabilities Act was passed in the Parliament, and we have very substantive. This is very interesting because we can see the changes. How do we see the changes? How in particularly in the previous law, there was no mention of disaster management. Now we have a law which talks specifically. We have clauses 8, which says the National Disaster Management Authority and the State Disaster Management Authority shall take appropriate measures to ensure inclusion of persons with disabilities in its disaster management activities. And all this are listed out, and it's already in our law. But what happens in the real time? A big challenge, one of the biggest, I think, examination that came to us was during COVID, when COVID was announced, and we could see that large number of people with disability did not get proper information. I'd start with COVID, and I'm from West Bengal, so we see a lot of cyclone warnings are happening almost every year now. It's become a part of our life. Of course, Amphan was one of the biggest challenge, that being west in Kolkata, even the city was how devastated it was. So I still remember when Amphan, the day took place, post Amphan, and I'm in the main city, we didn't have electricity for 5 days, complete 5 days. There was no electricity. So we are like you're getting totally cut off from the world. How? And it's like an eye opening for people like us who think we are privileged, and how a disaster can actually make you completely, like, totally cut off from the world. And it was during, of course, a fast lockdown phase was going on, so it was like a double kind of disaster happening to us together at the same point of time. So during COVID, what happened is all of a sudden we heard that the lockdown is happening, and a lot of, as our previous speaker was saying, there had been a lot of misinformation also, which was spreading, and we used to see the government directives that were coming to us, and a very important thing that we started doing is we realized that we don't have enough material, enough communication for people who are visually impaired, who are hearing impaired, who are intellectually disabled, and as also psychosocial disabilities. So we need to cater to all kinds of disabilities. Again, it is important to remember here with the new law being passed, we now have 21 categories of disabilities in India. So we need to think of all of them. You cannot just leave one person behind and one category behind and work for one particular one. So it was a very challenging time for people like us. So there was also, we also demanded something more from the government. So actually at that point of time, NHRC, National Human Rights Commission, gave a directive, which was a very well-written directive, where it said that during this kind of disaster, there should be some specific different kinds of instructions for people with disabilities. It cannot be exactly the same, because when they are being told that, when many people were being told that you cannot have any caregiver coming to your place. So there had been like elderly wheelchair user people, even in the big cities, who were totally dependent on say a maid coming in and cleaning her up and doing things. So if you just stop doing entering in a flat, in an apartment, and I'm talking of, this is also happening in the big cities also. So it was very the requirements are different sometimes during a disaster. Of course, we know that population in the villages are much more vulnerable, but even in the cities, that some challenges came up. And so the Human Rights Commission came up, and they also said that in this kind of cases, it should be the Disability Commissioner's office, because according to the law, we have Central CCPD's office, Central Commissioner of Persons with Disabilities, and every state should be having a state commission for persons with disabilities. So the Commissioner's office should now work as a nodal agency and work in together in collaboration with the other departments. Otherwise, it's very difficult, because sometimes we are saying that, okay, communication will make it in. So we used to do like small, even how to wash hands, how to wear a mask. And the beginning of the COVID period, I remember we used to do sign language, very short videos, and try to spread it through WhatsApp groups, and a different kind of social media was used very much during COVID period. But it's not just giving a sign language video. It needs a lot of other things have to keep in mind, because requirements, if you think of 21 categories, then the requirements are also differ from each other. And we know that the most vulnerable, of course, live in the village, where even to send any information, the means of sending information becomes very difficult. Particularly, I talk a little bit about cyclone part, because we have been facing cyclone for almost every year now. Sometimes it's very impact is very big. Sometimes it's not so much, but there are the training of rescue workers are also very important, particularly about the disability training is also very important when we're talking about the when the rescues are happening. The people don't know how to communicate with a person who's either hearing impaired or any kind of disability, even with intellectual disability. So there are symbols available. It's not sign languages for one particular kind of disability, but there are other kind of boards available where symbols are there, which can show and like talk to people. Maybe, and its local language doesn't only mean Bangla for us. It means so many other ways of communication. So maybe if you put up a red flag, a person might understand that this is something emergency and I have to evacuate now. So those kind of symbols, and we find that usually the rescue workers sometimes are not aware of this kind of languages, which are actually, I don't like blame anyone, but even when there are rescues happening, evacuation happening. So very few rescue centers also have a wheelchair accessible toilets, or uh, uh, many people also, I think it's very important to think of there will be also disabled women coming in, generally women coming in. The sanitary napkins are not available in those kind of rescue centers. These are the things that we have seen in our working with when during a disaster is happening. Uh, One very important thing that is important to remember here, of course, we use radio, community radios, and radios, but and the social media. But since there are so many different kinds of disabilities, there cannot be one parameter that if I, it's not a tick mark. It's like there are different kinds of disabilities and the requirements are different. So, and particularly one thing that is very much neglected during any disaster is the trauma part, the psycho social disability part. That a lot of time it happens that a person becomes disabled post disaster. So it's not that even if we have maps, that even if we have mapped a village and say that these are the number of disabled people living in this village, so these are the requirements. There will, for every disaster, for something like Amphan, as big as Amphan, or the super cyclone in Orissa that happened, will always, the number of disabled people will always increase post that uh, disasters, the cyclone is affected. And that is something is we have to keep in mind also, because it's just not I mean, trauma is not something that it happens once and you forget about it. You have to live with that trauma, that you have seen a cyclone coming in, destroying your house, and you have to move, evacuate, then you come back and you don't see uh, the usual place. So how do we include, I know today's session is mostly on communication, but I personally feel we need to talk more about mental health also. We need to include those kind of issues also when we're talking about disaster management. And for us, it's not just the NGOs. It's very important because most of the disability NGOs, if you think of, are urban based, are based in cities, big cities. So we talk more about involvement of people, DPOs, the Disabled People's Organization, who are working in the grassroots. And these are the people who actually have more knowledge, more uh, acceptance in the community, because they're going from village to village, from, and if you're in a city, in the from slum to slum, they're going in that kind of work. So NGOs are more, for the disability NGOs are mostly those who are running special schools or giving some service. So it's like they are not going somewhere. The disabled people are coming to a special school. So the children are coming to specialized centers. There is a big difference. And for us, it is very important that DPOs are involved in, from the beginning, from the planning of the management, disaster management. How do we include these DPOs? But the disabled people have their own voice, and they can see, like, this is my requirement, and I need this. Without that involvement, it will be very difficult to actually say that we are not leaving anyone behind. There are so many kinds of disabilities, and we need to think, hear their voices, that what exactly is the need. Thank you.
Thank you, ma'am. Thank you for sharing your insights with us. I'm sure now our participants are more in tune and more aware of the requirements of various disabled people and what needs to be kept in mind while planning for disaster management and disaster relief and response and communication, basically. So, thank you so much. Now we move to the question and answer part. If anybody has a question, they can either write it in the chat box or they can raise their hand and we can take the questions. I can see that in the chat box, a few questions were directed at Mr. Anil Gulati, but he has already answered the questions in the chat box. So if anybody else is curious about that, they can read the question and his subsequent responses in the chat box itself. Let me see if there are any questions. So I can see that all the participants have appreciated the presentation that our speakers shared with them today, and all of their insights from the field and from working in the area for so many years. Gursimran, can you see any questions? I can't. If we don't have any questions, maybe we can close this. I think
Yeah.
our participants have learned a lot and they have a lot to take with them, to think about and to recontemplate. So I would now invite Mr. Gursimran from Sphere India to give a brief vote of thanks so that we can officially close the webinar and close for the day. Over to
Yeah.
you, Gursimran.
I'm audible.
Yes, you're audible.
Yeah. Thank you so much. Thank you so much for joining us today at this insightful session. And we will have more webinars on this topic, on many other related topics. If you have any suggestion or feedback, please feel free to write to us, and stay tuned our social media channel to regular updates on Sphere India Academy. And thank you so much, Atisha ma'am, for moderating the session and our planners. Thank you so much.
Thank you, everyone. Bye bye. Have a good day.
Thank you. Bye bye.
Yes, bye bye, Karan.